start first. So, as I said, we have some questions about the relationship between the kidney health and diabetes. And to answer those questions, we have with us Dr. Varun Kumar Bandi today. Dr. Varun is an accomplished nephrologist and associate professor and head of the nephrology department at Pinamani Siddhartha Institute of Medical Sciences. Welcome, Dr. Varun. We are so excited to have you here for this live session.
Thank you. Thanks for the introduction. It's nice meeting you.
Same here, Dr. Varun. So, viewers, if you have any question of your own or around the correlation between kidney health and diabetes, please share them in the chat. Once I'm done with my questions, I'll take up yours. So, shall we begin, Dr. Varun?
Sure.
Great. So, I'll start with the basics. What is diabetic nephropathy and how does it develop in individuals with diabetes?
Diabetic nephropathy is actually a broad term which we coined to cause any effect of sugar of diabetes on the kidney. We give a label as diabetic nephropathy. Different types of it, depending on which part of the kidney is involved. So it usually the common one is it starts with the patient starts losing some protein in the urine. Followed by that creatinine starts going up. The kidney function starts declining. That's the commonest presentation. So first and foremost presentation most of the times is the loss of protein in the urine.
Oh. Okay. So so apart from this, what are some early signs of diabetic nephropathy that diabetics should be careful about?
The first most difficult part of being a nephrologist is most of the diseases do not have any signs or symptoms until you do an investigation. So someone gets to they go to a sugar doctor and on routine examination as a part of annual checkup they do a creatinine or a urine test, then they detect these things. So it's most of the times asymptomatic. If symptoms are there, the most common they will be having is presence of swelling of the feet, what we call speed edema. So they can have swelling of the feet. Or sometimes they can notice froth coming in the urine, like how a surface, like a washing powder. So when patient urinates, after passing urine, you can see that washing powder like froth in the bathroom, the restroom.
Okay.
So there are two common symptoms.
Okay. So how can people with diabetes monitor their kidney health at home once they are diagnosed with
Once diagnosed, the only thing is you can watch for development of any signs and symptoms. Most commonly, the first is, as I told, the presence of swelling of the legs. Second thing is the frothing of the urine. And third thing is always keep a close watch on eyes too. Because usually in diabetics, especially type 2 diabetics, which we commonly see, when there is kidney involved, almost 2/3 of them also have some extent of eye involvement. So it's very important that you also keep a tab on your eye, on your vision. If your vision starts decreasing, the better to get it checked up.
Right. So before we continue further, for our viewers, I have some exciting news to share. If you're serious about diabetes management and eager to connect with like-minded people, join our supportive community of individuals like you. Simply drop a message in the chat saying I'm in, and we'll make sure that you get an invitation. Or you can find the link in the bio. So moving on, Dr. Varun, how often should diabetics get their kidneys checked?
If they do not have any dysfunction, the first time, you can, once they do a urine test, and urine usually we do for urine albumin and serum creatinine. So these two things have to be done. If not done, if it's a type 2 diabetic, that means type 2 diabetic, the ones which develops at an older age, who are on tablets, for them, whenever they diagnose with diabetes, we need to get this test done. If they are normal, you get it done once every year. Whereas on the other hand, for type 1 diabetics, the diabetes in young, those people, if they do not have, if the diabetes is well controlled and they do not have any other issues, you can do once in 5 years. After diagnosis, you can wait till 5 years after diagnosis and do it. Afterwards, again, you keep checking annually. Or even in young people, if the sugars are not well controlled, if sugars are very high or they have high family history, any of these factors, then we do more frequently and at earlier age rather than waiting for 5 years.
Okay. So, what lifestyle changes can help slow the progression of diabetic nephropathy in an individual?
The first thing is salt restriction. We most of us have been under Western influence and we have this habit of eating a lot of salt, all fast food, all the junk food, it contains a lot of salt. So always make the habit to cut down the salt, and whichever snack or whichever food item you're picking up from a store, just flip it over and try to have a look at its salt content. They have markings on that of how safe it is. We often tend to ignore them, but just learn that and make it a habit. Then you start cutting down your salt. Then exercise at least 30 minutes of minimum of brisk walking. Anything above that is good. Minimum requirement is 30 minutes of brisk walking at least 4 times a week. So anything more than that is definitely better, but this is the minimum target you have to reach. And again, weight loss, even if you do not have a nephropathy, even if the kidney is not yet affected, or even for people whose parents or their siblings have diabetes, so they can have chance of getting diabetes. Those people, if they cut down salt, sugars, and if they increase the walking, what will happen is increased exercise cuts down the insulin resistance. That will delay the development of diabetes or even prevent the development of diabetes. So exercise is a very important component which most of us ignore.
Right. So exercise and as you've already spoken about the exercise and all of that, what are there any dietary guidelines to protect kidney health for a person with diabetes?
The first thing is salt restriction again. Usually we tend to advise, normal recommendation is less than 2 grams of salt per day. We Indians tend to consume about 8 to 10 grams. So it's too high. So try to cut down the salt as much as possible. Eat more of vegetable protein rather than animal protein. So start increasing vegetables and fruits. So that we take care of the non-veg proteins have more phosphate in it and more cause more damage to the kidneys, whereas vegetable proteins are more safer and they are digestive more. The metabolism is much easier in the body without much side effects. So they're easier. It is good if you take a lot of vegetable proteins.
Okay, so that was all from my end. I don't see any questions from the audience. No, we don't have any questions from the audience. So that was all. Thank you very much for this informative session, Dr. Varun. It was very good to have you.
Thank you.
And to our viewers, thanks a ton for being a part of this live session today. At THIP Media, we are dedicated to delivering expert health information for your well-informed choices. Steer clear of unreliable health advice on social media. Follow the Healthy Indian Project on WhatsApp and other social media platforms for trusted health updates. Remember, when you know better, you live better. Stay informed and stay healthy and safe. Good night. Good night, Dr.
Thank you.
Varun.
Good
Thank
night.
you.
Thank you.